Okay, not gonna have you learn a lot of the blood vessels. You have to know those blood vessels go in and out of the heart, but there are some that I expect you to know. First of all, most of you should be familiar with this big vein on either side here coming down. That's your jugular vein. You actually have two, but for you guys are just gonna learn jugular vein. It drains the blood down from the, of course, head and brain down into the heart, and it'll go into the subclavian vein. Right next to it, you can see the carotid artery. Now again, you get to A&P2, you'll have to learn the different carotid arteries, because there are different ones. There's common, there's right, there's left. There's internal, there's external. But you're just gonna learn carotid artery. Except coming off the heart, you have to know the left common carotid. Okay, you have two subclavians and brachiocephalic. So this, if you remember, is the superior vena cava, and the vessels draining into it, because veins always go toward the heart, are the two brachiocephalics. And you see the jugular comes down and merges with the subclavian here. So you have a subclavian here, jugular, brachiocephalic, superior vena cava. The carotid's coming up here, and it's harder to see, but the carotid, if you remember, branches off into the left brachiocephalic, and then the common carotid, left common carotid, and then the right subclavian artery. If we go down through the torso, you'll see the aorta is going down. Here's the aorta. These three vessels here are called the celiac trunk. Usually don't have you guys learn those. Here's your superior mesenteric. Here's your renal vein. Here's your renal artery. Go down, there's your inferior mesenteric. But at the very end of the aorta, it splits in two. And these two branches are called the common iliac arteries. And so this is your common iliac vein. That will also be on your chart. And I think inferior mesenteric's on there and superior too. Then you'll see that common splits into the internal iliac and the external iliac, and the external iliac will go into the femoral artery. This is the external iliac vein. It's coming from the femoral artery. It's also coming from the great saphenous vein. This is great saphenous vein. It's the most medial vein. It's very superficial. It merges with the femoral vein, and when they merge here, they will go up into the external iliac vein. There's no great saphenous artery. There's just a great saphenous vein. Down in the lower leg, you'll have to know the tibial artery and the tibial vein, and that's it for the lower leg. In the arm, of course, this bottle doesn't have an arm. You'll need to know radial artery and radial vein, ulnar artery, ulnar vein. In the upper arm, it's the brachial artery and the brachial vein. The brachial vein will flow into the axillary. You need to know axillary artery and vein under the arms. Okay. And that should be it for blood vessels.